Yes, let's talk about it.
So yes, any glue, Exofin, Dermabond, pretty much any cyanoacrylate you can get your hands on. So what I do is I clean the crap out of that site before the removal. You don't have to. There's no real evidence of an infection happening at that site after the removal, but any wound, I like to clean it. And then right after the removal, I'll put a lot of pressure on that IJ while I'm cleaning and aggressively, with a lot of pressure, soaking that site with the chlorhexidine wand just to make sure we don't get any infection at the site. Any kind of cut you want to clean, it's a cut. Yeah, it's been cleaned, for week after week or at the insertion or whatever, but, still, I don't like bloody gunk on my wounds. And so I'll clean that site, apply that pressure with dry gauze. And while I'm applying pressure at that site, I'm letting that site not only just clot off as much as possible, but I'm giving that thing time to dry. So after about, 15, maybe even 30 minutes, it depends on their coags, I will ensure, and this is the hardest part, is that, when they're lying down, they're not bleeding or continuing to bleed. If they do, that's a whole nother issue, because you need these cyanoacrylate, you need the skin to be very dry for the glue to work. And so after I apply pressure for 30 minutes, ensure that it's not going to bleed out at the insertion site, I'll pinch the skin like we're supposed to, based on the IFUs of the Dermabond or the Exofin. And again, whatever cyanoacrylate glue you have, I'll pinch the skin like I'm supposed to per instructions, apply the glue, and apply it generously. I'll use that whole vial. I'll squeeze every drop out of that vial to cover that site and make sure there's no opening to create a wet seal. And just in case there's a small hole, I will apply petroleum jelly around, or antibiotic ointment, which is basically made out of petroleum jelly, with petroleum jelly, and then cover around the dry glue area to really get a wet seal, or use Zeroform, whichever you want. Remember, key is the wet seal. I'll do that, and then let the thing get dressed, and then patient's on their merry way.